Well, a warm welcome to today's talk. It's Monday the 8th of August. Now, monkeypox has just been declared a public health emergency in the United States. And I think this is justifiable because we have a window of opportunity to get rid of this new zoonotic infection which is spreading amongst gay and bisexual men predominantly at the moment. We have a window of opportunity to stop this from spreading, to stop it becoming endemic, and to stop it getting into animal reservoirs as well as infecting many other human beings. So we need to act on this, and there's two things we need to do. One is we need to introduce vaccination, which is happening now in the United Kingdom and in the United States. But also, and this is critical, it needs to go with vaccination, is we need behaviour modification. People need to restrict the number of new sexual partners that they are having, at least for a period of time until we can get rid of this infection. We do not want another HIV where a disease develops in a particular community, predominantly gay and bisexual men, and moves into the general community. One of my particular concerns about monkeypox is the risk to children who have no immunity at all to these types of viruses, and potentially to unborn children, affecting pregnancies as well. So, public health emergency in the United States. So I completely agree that this, unfortunately, is the right thing as declared by the Biden administration. So no qualms in agreeing with that at all. Now, this is the CDC site, which as a result largely of the COVID situation, I think has become really quite sophisticated. So we can see the states that are most affected here. California we see is dark blue, whereas Nevada is light blue. And of course, Montana and Wyoming are no relatively low populations, but so far no reported cases. Now, of course, this doesn't mean there's no cases. It means that none have been officially recorded as of yet. There probably are cases, and in fact, this is a great under-reporting. Although they might not be in these states. We don't really know. The low populations. Anyway, what we do know, Texas, again, higher numbers. Georgia, Florida, fairly high numbers. And then up in the New York, higher numbers. And Illinois, higher numbers as well. And you can look up your state. Washington, 175 already. But we know that these are only officially reported cases. So I just want to do a little brief background. I think I'll keep this video short because I've got a huge amount of data to give you, but I'll just give you the headlines about the symptoms at the moment on this one. What to look out for. So United States, 7,510 confirmed cases. I think we know it's higher than that, of course. Rash may be located on or near the genitals or anus. Now, this is reflecting the modality of spread at the moment, predominantly in the gay and bisexual men community. Could be on other areas like the hands, feet, chest, face or mouth. So even though that's where the virus got in, probably in this area where it got in, you can get systemic manifestations in other areas as well. And the rash will go through several stages, including scabs before healing. So it tends to start as a pustular spot. That's what pox means, actually. It means a pussy spot. So smallpox is the classic one that's been a terrible disease throughout human history. Cowpox used to be quite common in the UK, that was transmitted from cows' udders. So cowpox, smallpox, monkeypox, that they're in that particular group of virus. Now, I get asked a lot about chickenpox. Chickenpox is a completely different type of virus. Nothing to do with it. It just gives it a pox type clinical feature. So the three viruses in this group are monkeypox, cowpox and smallpox. Thankfully, no wild cases of smallpox at the moment. Hopefully we won't get any either. Chickenpox, completely different virus. I've had chickenpox. I think virtually everyone gets chickenpox. So it's not chickenpox. It's the other one. But the rash is what you might call a pocky rash, a pox type rash. Can leave scarring. I've actually got a couple of small scars from where I had chickenpox as a child. So these pox type rashes can leave scars. Rash can initially look like pimples or blisters. It may be painful or itchy. So again, these are things to look out for. And of course, if you have these, we need to report these to medical authorities, sexual health clinic or whatever you have available. And of course, make sure you don't spread it. Be in isolation for a period of time, probably 3 weeks actually is the UK thinking. Other symptoms. Now, this is where it becomes systemic. Now, in the UK data, the data for this isn't out in the United States yet, but 95% of people who get monkeypox get the rash, or there's a 95% association with the rash and a positive diagnosis. Only 65% of people get systemic symptoms in the UK, and I've no reason to suspect it's going to be any different in the United States. Don't really see why it should be significantly different. So these are systemic features, meaning that the disease is affecting the whole body. So we could say that the initial rash, at least, if it's in the genital and anal area, is a localized reaction. Whereas the rash, if it's in other parts of the body, or if these other symptoms are there, that's a systemic reaction. So fever and chills, those two kind of go together. You feel chilly while your temperature is going up. But always worth taking your temperature if you can. Swollen lymph nodes. This is called lymphadenopathy. So lymph nodes are in places like in the neck, under the mandible, in the axilla, in the groin. You can feel for lymph nodes and see if they're swollen. You can feel the enlarged lymph nodes under your finger, called lymphadenopathy. And that's not surprising because the lymph nodes, of course, are involved in protecting us against infection. They're lymphoid type tissue. It's where the white cells multiply. So it's not surprising that you get these lymphadenopathies, these swollen lymph nodes in some systemic infections such as this one. Excessive tiredness, exhaustion, muscle aches and backaches. Again, very, very common. When you're getting any virus, you can get muscle aches and backaches, headaches. Respiratory symptoms, sore throat, nasal congestion or cough, also possible. And this is another one of the concerns, that people can cough out this virus and it can potentially spread in the air as well. Now, there's no documented cases of this happening yet, but the virus has been detected in hospital wards, in hospital rooms where people are being managed with monkeypox, although, as we say, no cases have spread, at least in the UK and Europe, via the droplet route as of yet. But we're in early days. There's a lot of things we don't know yet. You may experience all or only a few of the symptoms. Sometimes people have flu-like symptoms before the rash. Some people get a rash first, followed by symptoms, and others only experience a rash. As we said, only about 65% of people get symptomatic infection. And new data from the UK looks like there's a proportion of people, we don't know how big it is, that get asymptomatic infection as well, therefore could potentially be transmitting this on. So, okay, 7,000 people in the United States with it at the moment, 7,500. The real number could easily be double that, of course. But still this opportunity to get rid of it before it becomes endemic, before it establishes in different communities, before it potentially establishes in animals. So we could get the potential for reverse zoonosis, because this comes from animals where it originally came from in Africa. So I think I'll leave that there. Just a brief thing to be aware of, to increase awareness of this condition. And do tell your friends who might be in a higher risk grouping about these symptoms to look out for them, to be aware of the significance of them at this time, and their important role in potentially preventing this disease from becoming endemic and getting rid of it. Now, I've got a huge amount of information now from the UK government, which I've got here. Lots of data from the UK government and a couple other sources, which I will hit you with in the next video. It is pretty data intense, so if you want a lot of information, come back for the next video. I'm just going to record that now while it's all fresh in my head, but for now, thank you for watching.